So I did my project on the post-traumatic stress and the comprehension of everyday activity, and this research was written by Michelle L. Eisenberg, Jesse Q. Sargent, and Jeffrey M. Zach. So before I begin my presentation, I chose this topic because I wanted to understand the effects of PTSD, as many of us are aware that people with PTSD often have difficulties with attention and memory involving everyday tasks, and formally and in many cases, it is often unrelated to their trauma, so we must recognize a critical component of how standard comprehension and segmentation can be affected in their everyday lives. So the main focus is to try and understand whether or not PTSD symptoms are correlated to impaired segmentation and memory that impact their ongoing daily activities. PTSD changes the body emotionally, mentally, and physically. It drastically alters the hormones and chemicals that receive information in our bodies, so understanding the impacts of PTSD can help individuals dealing with PTSD make sense of their trauma. So, in this case, learning skills that can build their self regulation and self efficacy skills can definitely help them with their trauma. What is the topic of the study and why is it important? So, the study really emphasizes the disabling symptoms of PTSD that causes impairments to someone's attention and memory. The symptoms people experience are often detrimental to their way of living and often find it difficult to accomplish daily tasks. The study is essential as there is little to no research on how people who experience PTSD comprehend and retain their everyday experiences. Understanding segmentation for people with PTSD provides a method of assessment with cognitive impairments in people who have PTSD, as it can be used as a guide in understanding the deficits of memory and their comprehension. What did the authors hypothesize? Before the researchers created the hypothesis, they asked participants to complete an event segmentation and memory task study. Participants were also given another task to cover their episodic memory, executive function, and general knowledge. The researchers' approach is to brainstorm the results and create a hypothesis according to the assessments. They hypothesized that if possibly having control of the general cognitive function, researchers can perhaps find an explanation for the variance in the performance of the individuals regarding memory and segmentation. Along with that, the researchers hypothesized that symptoms of hypervigilance can impact segmentation and memory tasks. What was the independent variable? So the independent variable in this study is the variable that researchers manipulate or change. So in this case, it was the control of general functions. The researchers used the assessments to control the research as they specifically chose general cognitive functioning that might suit each of the participants. The researchers used independent variables to help individualize the participants' needs according to their assessments. In this particular research, the independent variable influences the variation of the dependent variable, as the value of the study does not change solely on the outcome of the independent variable. It is an operational process that ensures that the research is being wielded to be observed and changed. The researchers bolstering the independent variable can measure and determine if the independent variable causes any slight or drastic changes to the dependent variable. So the independent variable in this study is crucial as it represents the primary cause for the study's outcome. What were the dependent variables? The dependent variable in the study is how the participants' reactions to hypervigilant scenarios. Since the independent variable had various concepts of the general functions, it caused many different responses and feelings from the participants. Since the general functions had multiple ideas, each of the participants experienced various levels of hypervigilance that caused questions about the variables being tested in the experiment. In this particular experiment, the dependent variable has to change only because of the independent variable. Therefore, it ensures that both the dependent and independent variables can be measured accurately. The dependent variable in this particular study is the effect in the experiment that needs to be explained. Summarize how the researchers conducted the study. So the research was conducted using a cross-sectional study correlating the participants between age, cognitive ability, and event segmentation. Approximately 200 adults participated in the study that required completing the cognitive questionnaires. Out of the 208 participants, approximately 137 of the participants performed correctly. When testing the event segmentation memory variables, the researchers asked the participants to watch 3 movies of everyday activities, such as preparing breakfast. Since the film was placed in a 329 to 376 seconds long position, they were asked to segment each movie twice. First, the participants pressed the button that determined if the film had a large natural unit or a small natural unit. For the memory task, participants recalled parts of the movie they remembered but only had 7 minutes to complete that task. Next, 3 participants viewed every meaningful action in the film. But if 3 mutually had the same answers, it was recorded in a scoring template. To assess the cognitive functions, the participants were asked to perform 3 individual tasks from the 5 domains of cognitive functions. So the first is working memory, episodic memory, executive function, processing speed, and general knowledge. Lastly, the procedure performed a PTSD measure. The TLEQ was used in an experiment that determined the 22 types of potentially traumatic events. In addition, the participants needed to report if they experienced any negativity throughout the experience, such as the number of times that they might have felt uncomfortable during the experiment. The test was measured using a 5-point scale in which all 3 clusters were individually calculated that ranged from about 0 to 80. Since it was a cross-sectional study, the participants spent and completed about 2 115-minute sessions in a controlled room. What were the major findings? So regarding the TLEQ test, 7 of the participants reported that they did not experience any trauma in their life. 6 reported 1 traumatic event, and 124 participants reported having experienced 2 traumatic events in their lives. The 7 participants that said they did not experience any trauma had a PSDS score of 0. For the event segmentation results, the buttons pushed varied from 8 to 288, with a mean of 61.59 and a standard deviation of 48.39. However, the participants reported having similar segmentation across the movie. The researchers found out that the number of the meaningful units of the segmentation showed no correlation to any PTSD severity symptoms. The 5 domains of cognitive asks were found during the analysis, but they also used the z-scores. The researchers used a factor that found that the composite variables and the executive functions did not link together. Therefore, the variable was dropped. When predicting the segmentation agreement, it was organized in a scatter plot that was then turned into a regressional analysis. The gender was entered first, following age, education, and general cognitive functioning. When the 4 variables were entered into the equation, it resulted in 14.8% of the variance towards the segmentation agreement. But when the symptoms of PTSD were added, it accounted for 3.8% of the variance. When the researchers predicted between the event memory and PTSD, the correlation was about negative 0.16. And then the relationship between segmentation and memory turned out to be 0.46. When gender, age, education, and variables were added, it turned out to be 36.3%. So in this model, only gender and the working memory explained unique variance in the study. Lastly, the results from the segmentation and event memory from PTSD symptom clusters showed that perception, hypervigilance, and arousal were created using 3 additional multiple regression analyses. When the results accounted for the 4 variables, it accounted for 3.0% of the arousal for the variance in segmentation and 1.6% for the variance in memory. Was the study replication of another study? If so, were the results consistent with the original work? If not, what was different? So this experiment was initially done by the National Comprehension Survey. So they surveyed about approximately 9,282 participants between the years of 2000 and 2003. So after a 12-month study, they found a 26.2% rate of many psychiatric disorders and found that 17.9% utilized mental health services. They found that it is unlikely that the medication therapy changes the pattern of the results. So the replication of the study provided some evidence regarding the role of PTSD and the deficits of segmentation. If there are peer review comments, included on the website for the article. Spend a little bit of time summarizing them and your own impressions of what the peer reviewers wrote. So, in a more depth explanation, the peer reviewers commented that the researchers must consider using participants with precise diagnosis of PTSD and asked if the researchers could link the severity of the symptoms to the behavioral measures. The researchers also advised creating a table of the precise amount of participants. Peer reviewers also reported that the researchers needed to add information about the medication and therapy because they commented that the researchers' approach to the movie segmentation needed to also be transparent. They explained that the order of the movie should have been more transparent, and the researchers needed to add more details and information about the setting and procedures. For the word recall study, the peer reviewers suggested using the same procedure as the learning segmentation of the research so it reduces any biases between the correlations. And so the peer reviewer also mentioned distinguishing between the younger and older participants of the study. So the event segmentation and memory tasks aren't heavily influenced by any issues in the study. So the peer reviewers mentioned that the researchers should explore how PTSD affects the younger and older participants, memory, and their segmentation. Lastly, the peer reviewers highly suggested that the researchers needed to discuss correctly and to identify the role of PTSD and its association between anxiety and depression that contains reliability of the results. So, in conclusion, overall, the research findings suggest that the individuals with higher PTSD symptoms show difficulties with event segmentation, as researchers developed that with the help of training, people with PTSD can be more adaptive to their environment, which can help them understand their working memory for everyday activities. It came to this conclusion because the research had no prior hypotheses about the dissimilarity between the course of the study and the acceptable segmentation agreement. When researchers composed the variable of the executive functions into the regression analysis, it measured the cognitive function of the participants. They found that the patterns did not modify the executive function and did not demonstrate a variance in the segmentation agreement or in the memory task of the participants. So, in conclusion, the researchers found a particular outlier in the research, but when they removed the specific outlier from the study, the variables in the study remained extremely constant.